Welcome to Spinal Moves, the video series. This is an educational series on activity-based therapy, or ABT for short, a novel intervention used to improve recovery for people with spinal cord injury. I'm Hope Jervis-Rademeyer, and I'll be narrating this ABT video series along with my Spinal Moves co-host, Anita Kaiser.
Thanks, Hope. For the Spinal Moves podcast, Hope and I engaged in meaningful conversations with individuals living with spinal cord injuries, or SCI, therapists who work in neurological settings, and researchers who study ABT. The ABT video series has been adapted from the original Spinal Moves podcast. Today's video will be an introduction to activity-based therapy and feature two guests, Dr. Kristin Musselman and Kristen Walden.
Dr. Kristin Musselman is a physical therapist, assistant professor in the Department of Physical Therapy at the University of Toronto, and a scientist at KITE Toronto Rehabilitation Institute. The overarching aim of Dr. Musselman's research is to develop innovative, clinically feasible approaches to restore movement, function, and participation for individuals living with complex neurological disease across the lifespan.
Kristen Walden is currently a national clinical liaison for the Praxis Spinal Cord Institute and a physiotherapist at Vancouver Coastal Health. In her role at Praxis, Kristen works on a number of research and best practice initiatives with the aim of improving care for individuals with SCI or disease across the country. Dr. Musselman will now start us off by explaining some definitions and key differences between exercise and ABT.
So exercise, it's structured and repetitive physical activity that's performed with the intent of improving physical fitness. So typically, if you're engaged in exercise, you're aiming to reach those sort of moderate to high cardiovascular training levels, and fitness is the primary goal. With ABT, as I mentioned, fitness can be an important piece of why you would engage in ABT. But along with ABT, it's that engaging the neuromuscular system in areas of the body that have been affected by neurological damage. You could have an activity that would be considered both exercise and ABT. So to give a concrete example, somebody who's living with paraplegia who participates in an FES rowing or cycling, lower limb cycling program. So through that program, they're going to be engaging in cardiovascular training. But at the same time, they're going to be engaging parts of their bodies that have been affected by injury, whether that's voluntarily or also with in this case, the addition of electrical stimulation to try to help get that neuromuscular activation. So that is an example that would be both exercise and activity-based therapy.
So when is exercise not considered ABT?
In that case, it's because, the exercise is not targeting parts of the body that have been affected by injury. So if you take the same individual with paraplegia and instead to improve their fitness, they're engaging in arm cycling, for example, that would be exercise, but wouldn't meet our definition of ABT. So activity-based therapy is a therapeutic approach that's quite focused on neurorecovery. So it includes activities where you're aiming to get neuromuscular activation of parts of the body that have been affected by neurological damage. And as I mentioned, it's really focused on neurorecovery, and really our understanding of activity-based therapy and the way it's really evolved in tandem with our understanding of neuroplasticity and what the nervous system is capable of following neurological injury. So in the case of somebody who sustained a spinal cord injury, we're aiming to target areas that are below the level of their spinal lesion. So for example, if it's an individual who's living with paraplegia, this would include movements or function that includes the trunk and the lower limbs, such as gait training, standing training, lower limb cycling. For somebody who's living with tetraplegia, this might also include activities that engage the neuromuscular function in the upper limbs, and specifically the muscles that have been affected by the spinal cord injury. So it could be arm cycling or repetitive practice of reaching and grasping, for example.
We will now have Kristen Walden explain the concept of load bearing.
The idea behind maximizing load bearing is that the individual's body weight is supported as minimally as possible while performing movements with a relatively normal, functional movement pattern. Although there are many different exercises where load bearing is optimized, a great example of this would be bodyweight supported treadmill training. This is where a harness supports and lifts the trunk of an individual walking on a treadmill, so the individual's weight bearing is reduced and postural support is provided. At the same time, therapists are facilitating a functional movement walking pattern. As the individual's balance, coordination, and postural control improves, the amount of support from the harness is gradually lessened, and the degree of manual facilitation by the therapist may also be reduced.
The ABT principles 4 and 5 are about types of task-specific movements and achieving a high dosage, which Kristin Musselman will now explain.
So this could be a high number of repetitions. It could be a high level of cardiovascular training, but also a high level of motor challenge.
A high level of cardiovascular training involves a high intensity, where exercise are completed at levels that increase the heart rate. In fact, some ABT programs can last hours daily.
Exercises should also be completed at a high frequency, so several times a week with many repetitions. This may apply to load-bearing exercises as described earlier, or task-specific movements, to name a few.
Finally, individuals should be continuously challenged in their exercises to target the neuromuscular system below the level of injury, and this can be done in a number of ways, such as increasing the resistance, the speed, the distance traveled, or adding in additional tasks.
But activity-based therapy is not just focused on neurorecovery, so there's some other goals of this therapeutic approach. So for example, to reduce the occurrence of secondary complications that are associated with spinal cord injury. So reduce the incidence of pressure injuries or pulmonary complications, for example. And then also because many of the activities that would be considered ABT involve a moderate to high level of cardiovascular training, they also can help to improve physical fitness. So that also is a third goal of ABT.
The takeaway message for understanding ABT is expressed in the following quote. The difference really between traditional and conventional therapy versus ABT is that idea that people, regardless of their level of severity and time post-injury, have a chance of making functional gains. So recognizing that and maximizing people's potential is important.
Thanks for watching episode 1, and be sure to check out the rest of the series. For more information on the activity-based therapy community of practice, or to listen to the Spinal Moves podcast, log on to the website at www.praxisinstitute.org. You can also listen to Spinal Moves on Apple Podcasts, Spotify, or wherever you like to listen. Thanks to the Canadian Activity-Based Therapy Community of Practice, Praxis Spinal Cord Institute, and the ABT Video Committee.